This is Midwest Insurance Brokerage Service, the Affordable Care Act Essentials. Are you new to the insurance industry? Do you want a refresher of the Affordable Care Act? You're in the right place. We've created informational videos in the past regarding the ACA, but provisions have been consistently delayed, clarified, or updated, so we know it's important to update our information. Anything contained in this presentation is also subject to change without notice and should only be used for illustration purposes. It is not intended as legal advice. Consult with a lawyer and accountant for further guidance. The largest portion of ACA-related changes are implemented now. Let's recall what the Affordable Care Act is. The intention was to expand coverage, control healthcare costs, and improve the healthcare delivery system. To do all of those things, the law set out a comprehensive set of health insurance reforms to be implemented in stages. I will talk about the more pertinent changes like reforms to health plans and insurers, the requirement that most U.S. citizens maintain insurance coverage called the individual mandate, the creation of the exchange or marketplace where individuals and their families can purchase coverage, and for some will have access to premium and cost-sharing subsidies, an additional exchange for small businesses, the shop, and the requirement that certain large businesses offer a group plan or risk a tax penalty called the employer mandate. There are many other important reforms included in the Affordable Care Act, so this is just a few of the major topics and a general description of each. A health plan that was written prior to March 23, 2010 is a grandfathered plan under the ACA, and it is a plan that can remain active indefinitely. The benefit to keeping this plan is that grandfathered health plans are not subject to some of the provisions of the ACA. However, regulations permit these plans to make only certain limited changes and still remain grandfathered. Anytime I reference a non-grandfathered plan, it is referring to any plan that was put in place after this March date. Medical loss ratio, MLR, is a reform imposed on insurance carriers. It refers to the percentage of insurance premium dollars that any given carrier is required to spend on medical expenses, with the other portion allocated to administrative expenses. In the small group and individual markets, a carrier is required to spend 80% or 80 cents of every dollar, and in the large group market, a carrier is required to spend 85% or 85 cents of every dollar. Certain health benefits that are deemed essential to good health must be offered in non-grandfathered individual and non-grandfathered small group plans. This minimum package of items and services that must be covered by a plan was defined by one benchmark plan chosen by each state. Essential health benefits must include items and services within at least these 10 categories here. All of these benefits must be covered without any annual or lifetime dollar limits. However, other types of limits may be in place, including visit limits, day limits, or occurrence limits. The ACA requires coverage for preventative care services without cost sharing, such as coinsurance, deductible, or copayment, when the member uses a network provider. The list of ACA required services include those that are recommended and rated A or B by the United States Preventative Services Task Force. Some of those services include prevention for children like immunizations, preventative for women like well visits and breast cancer screening, and prevention for adults like colonoscopies and other preventative screenings. Each carrier will use reasonable medical management to determine any coverage limitations, including the frequency, method, treatment, or setting for the service. Pediatric services are required for children up to the age of 19. Some carriers embedded these services into the medical plans. Some carriers excluded the dental portion as a standalone. But in any event, from 2015 on, no one aged 19 or older may take advantage of these pediatric services. For plan years on or after January 1, 2014, plans cannot exceed the out-of-pocket maximum set by law for all non-grandfathered individual and group policies. In 2014, individual in-network coverage for covered services cannot exceed $6,350 or $12,700 for family coverage. Each year, the maximum limit is expected to increase. In 2015, the individual coverage maximum out-of-pocket in-network for covered services is $6,600, and for family coverage is $13,200. Non-grandfathered individual and fully insured small group plans must fit within 4 metallic levels that correspond to the plan's actuarial value. These bronze, silver, gold, and platinum plans are meant to make it easier for consumers to compare plans with similar levels of coverage. The metallic levels represent the overall cost sharing between the consumer and insurance carrier for total out-of-pocket medical expenses, like copays and deductibles. A bronze plan has the lowest insurer portion and highest consumer portion, which makes it a low premium plan. On the other end, a platinum plan has the highest insurer portion and lowest consumer portion, which makes it a high premium plan. Insurance carriers must now comply with new rating parameters in the individual and small group markets, referred to as community rating. Issuers can only rate on the following factors. For age, the oldest rate can no longer be greater than 3 times the youngest rate. Location, so each state is now split up into rating areas based on county as opposed to zip code. Family size, where a family with dependent children under the age of 21 will pay for no more than 3 children. And then there's tobacco use. Carriers are now allowed to charge up to 50% more for a tobacco user than a non-tobacco user. All individual policies written after January 1st, 2014 are guaranteed issue, which means an individual cannot be denied a policy based on health conditions, nor can any person pay a higher premium based on health conditions. Grandfathered policies are excluded from this provision. Pre-existing condition limitations are also now eliminated for enrollees of all ages. The ACA has mandated that consumers can purchase a new individual market policy or switch to a different policy within a specified period of time that happens annually, called open enrollment. For the 2015 plan year, open enrollment extends from November 15, 2014 through February 15, 2015. Policy effective dates are determined by the date of the application. Between the 1st and the 15th of the month, the policy would get the 1st of the next month. Between the 16th and the end of the month, the policy would get the 1st of the second following month. In the months prior to January 1st, the rule is just slightly different. You can see how the dates line up here. Each year, once open enrollment closes, the only way someone may enroll in or make a change to a policy is through a qualifying life event, which allows them a special enrollment period. A qualifying event includes changes to your family, loss of employer or other minimum essential coverage, or a permanent move to a new area. Effective dates for policies applied for outside open enrollment, however, depends on what the special event is and when the application is submitted. The marketplace, also known as the exchange, was created out of the ACA to allow consumers to determine if they are eligible for premium assistance or cost-sharing subsidies, and then allows them to shop and buy qualified health plans based on price, quality, and other factors among the various insurance carriers who sell their plans on the marketplace. Remember, though some people use the term Obamacare, these marketplace plans are designed and administered by private insurance companies. As an insurance agent, you must be certified to assist anyone who is subsidy eligible when they purchase a plan in order to receive commission for it. Eligibility for premium tax credits is based on household income and whether, based on the number of people in the tax household, the income falls within the federal poverty level, FPL, 138% to 400%. If the household income does fall in that range, the eligible tax credit is applied on a sliding scale, with more assistance available to those who fall closer to 138% and less to those who fall closer to 400%. Here is an example for household sizes 1 and 4. The FPL sets a cap for the dollar amount a household could pay for premiums. The percentage of FPL based off of the second lowest costing silver level plan determines the premium cap. Keep in mind the subsidy amount that a household is entitled to is a defined dollar amount regardless of how much the plan's premium actually is or which carrier they purchase the plan through, which means a household could buy down to a bronze plan and potentially pay less than the premium cap, or they could buy up to a more expensive silver or gold plan and pay more than the premium cap. The only way to receive subsidies is through the marketplace. When a consumer applies to the marketplace to determine eligibility, they are informed of their determination immediately, and when they pick and apply for the plan, the subsidy amount is paid to the insurance carrier on a monthly basis. And remember, because this is based on income, all subsidy amounts applied to a policy are reconciled on that corresponding year's taxes. But as a marketplace certified insurance agent, whichever carrier you are contracted with, you can place that subsidized policy and will receive commission on the entire premium amount. You must maintain the marketplace certification annually in order to continue receiving those commissions. In addition to income eligibility, subsidy assistance is also dependent upon several other conditions, including the consumer being a U.S. citizen or otherwise lawfully present. They can't also be eligible for Medicaid or Medicare. They're not eligible for affordable employer coverage and cannot be claimed as a tax dependent by another individual. And remember, most importantly, they must file taxes. The other aspect to individual marketplace assistance is the cost sharing subsidy. The income eligibility for this subsidy is stricter. It can only be available to those with household incomes up to 250% of FPL. The cost-sharing subsidy is different than the premium tax credit. It reduces the amount of out-of-pocket costs associated with the actual plan chosen. However, it is only available on silver-level plans. Again, here are examples of income for 1- and 4-person households, and how the insured portion of the plan changes depending on that income. A person and/or family could be eligible for both the tax credit and cost-sharing subsidy at the same time. The ACA requires most individuals to maintain what is referred to as minimum essential coverage, MEC. That type of coverage includes many different types of insurance, including individual policies, employer-sponsored coverage, Medicare, Medicaid, CHIP coverage, or VA coverage. Anyone who does not maintain some type of MEC for the entire year could be subject to a tax penalty. There are several exemptions available to help when there are lapses in coverage during the year, if someone qualifies for a hardship, and others, and that exempts them from paying the penalty. As with the subsidy, reporting qualified coverage or exemptions will happen each year during tax filing, and that's when any potential penalty will also be assessed. The penalty depends on household income and will rise from year to year. After 2016, the fine is adjusted for inflation. In the marketplace, separate from individual coverage is small group coverage. This falls in the SHOP, Small Business Health Options Program. An agent must also be certified to sell and receive SHOP commissions. SHOP is for small businesses that employ 50 or fewer full-time equivalent employees, FTEs, with additional eligibility requirements. One of the benefits to certain small businesses enrolling a group coverage through the SHOP is the small business tax credit. Available for only 2 years, the tax credit can be claimed by employers who employ fewer than 25 FTEs, making an average salary of less than $50,000 per year when the employer pays at least 50% of the employee's premiums. Different from the FTE calculation, the tax credit is based on a 40-hour work week as full-time. From there, the tax credit is applied on a sliding scale, where the employer can receive up to 50% of paid employee premium. Generally, under the employer shared responsibility provision, applicable large employers face a potential penalty if they do not provide minimum essential coverage to full-time employees that has both minimum value, which means at least a 60% AV plan, and is affordable, which means full-time employees cannot pay more than 9.5% of their income for the lowest cost self-only coverage in 2014. The affordability percentage will increase from year to year. In 2015, the percentage is 9.56%. Remember, only actual full-time employees, not part-timers, are eligible for group coverage. This flow chart walks through the questions an employer would ask themselves in order to determine if they're going to be subject to the employer mandate. Employers with fewer than 50 full-time equivalents are not subject to this responsibility. Here are a few important terms that the ACA has defined for the purpose of the employer mandate. Minimum average of 30 hours a week is considered full-time. A business has to count not just how many full-time employees it has, but also part-time employees. That's done by calculating the full-time equivalents. The idea here is that 2 part-time employees working 15 hours a week count as 1 full-time employee. The employer has to count all hours worked by the part-time employees in a given month, divide that number by 120 hours to find the FTE number. Also, the ACA determined that counting employees needs to include the employees in a separate business that is commonly owned or otherwise related. There are a few compliance reforms that every employer group should be aware of. First is the Model Notice of Coverage, also known as the Exchange Notice. This form is intended to accomplish several things for employees. There are two different versions of this form. One is for employers who do not offer a group plan. The other is for employers who do offer a group plan. Employers were required to provide the notice to each employee by October 1st, 2013, but now all new hires must receive this notice within 14 days of their start date. The second important compliance requirement for employers is related to Summary of Benefits and Coverages, called SBCs. Employers must provide appropriate SBCs to eligible employees at certain times, like upon application, upon renewal, prior to an off-renewal plan change, and at the request of the employee. An SBC is a government design template that includes what is covered by the plan, what's not covered by the plan, coverage examples, and more. It is not an exhaustive explanation of the plan. All plan details should be reviewed in the policy booklet. For fully insured group plans, all carriers make SBCs available for every plan, but it is actually the employer's responsibility to ensure the SBCs go to their employees. Carriers in the individual market provide the SBCs to their members directly. Another important compliance document is specific to group plans that have maintained grandfathering status. One of the many elements needed to maintain a compliant grandfathered plan is that the group must provide a statement and any plan materials to a participant that describes that the plan believes it is a grandfathered plan under the Affordable Care Act. And lastly, a group plan cannot apply any waiting period that exceeds 90 days. A waiting period is the period of time that must pass an employee to be eligible to enroll under the terms of a group health plan. Information on how to obtain the exchange notice, SBCs, and the grandfather disclosure notice can be found on our website, mibsga.com, as well as additional resources. If you are an agent who is not already contracted through us, please also visit our website for more information on how to do that. Again, this video is for informational purposes only. It is not considered legal advice, and please consult with a lawyer and accountant for further guidance.